Good evening or good morning, whenever you are listening to my new episode of Edgard El Chaar podcast. Tonight I have, or because it is tonight when we are taping it, I have a very special guest. She is also a member of our team, but Laura is a very special person. I have had the honor to know her for 5 years now and counting. And we have collaborated together, and she is an amazing and very talented prosthodontist, and I really mean it. She is a talented prosthodontist. She has trained at University of Illinois of Chicago and did her dental school at UPenn. Welcome, Laura, to my podcast. So, Laura, for the listeners meeting you for the first time, what do you want them to know about you? A little bit about your journey, how you ended up in dentistry, why did you pick dentistry? Well, it's not philosophical.
Well, my background, first of all, just me in general, is very interesting. I was born in Canada. I grew up in the Caribbean, so I grew up in Trinidad. I left when I was 18 to do all my tertiary education. So I did my undergrad in Canada, then went to Penn for dental. So that's a little bit about me. Mm-hmm. Growing up, which I didn't really realize, obviously, in the time, but your family is your village. So during the summers, when I was probably between like 6 to 10, childcare for me was in my aunt's office. She's an orthodontist, and her husband was her lab technician in the back. And I spent all my summers there, working in the back, fiddling with wax. He would let me fill in the holes of the models with plaster. And, I would just think it's fun. Then I'll go in the front, organize the toothbrushes. So, dentistry has been a big part of my life since then. And it was fun. I didn't see it as they were working. It was like a fun summertime for me. So that's when I was young. So it's kind of, that might be nurtured in me, essentially. But as I got older, I remember watching Dr. 90210. Yeah. And I was like, 100% I'm going to be a plastic surgeon. I just loved seeing the transformations. But as that was maybe teenage life, but getting into university, I started to realize that I really wasn't that much of a risky person. So I was more adverse to surgery, I would say. And then I obviously shadowed in dental offices. And I was like, you know what? I can have the same transformations on patients' everyday life without taking on the risk of doing surgery. And it was a perfect pathway of me. I mean, I come from a family of medicine and dentists, like it's clear. But dentistry it just made sense for me.
It's beautiful. I didn't know that about you. See, that's what I love about this podcast. So there was any moment in your life when you were in the dental school where you really clicked for you, this is it, this is what I love to do? Or you already knew before getting in?
It was probably more in residency. So prost residency is a very interesting one. There is a lot of lab work on the tail end that it entails. So I used to spend nights upon nights, weekend upon weekends in that lab doing lab work. And funny enough, I didn't mind. I actually enjoyed going in and doing it. And I was like, my husband used to call me and he'd be like, you in the lab again? And I was like, yeah. And then I didn't really realize that I was. And then I was like, I have to love this enough to be here every single day, all hours of the day. And I was like, this is meant for me.
It is. Pros is a lot of lab work, and that's people don't realize how much what goes behind the scene for the prosthodontist. So let's talk a little bit about it. This way they understand it more. For the layman people, prosthodontist is it's a weird name. I don't know why they kept it, but this is people who go 3 years for intense training in full rehabilitation.
Yep.
It's not a super GP. It's in contrary. It's a reconstruction.
Yeah.
So am I describing it correct?
absolutely.
And in order for them to do it, they need to learn what the lab technician does
Yeah.
in order for them to understand and
Yeah,
do it fine.
absolutely.
And there is a lot of hours in the
Yeah.
lab. So since we're talking about lab and all of these things, do you think with the digital workflow, with the new technologies, the analog thing, that pouring the models and putting it and spending hours on casting, waxing, and all of these things, do you think this art is gonna still be around, or it's gonna be metamorphosed completely and gone in the wind? Like 10 years. I'm not talking now. No, I'm not talking about 5, 10 years.
Funny enough, I'm in the era of more modern dentistry, of going digital, but I do think that there is still an artistry to ceramic work, that there will be a place for that. Digital dentistry makes things far easier in a way in workflows, but I do think when it comes to really aesthetic work, there will still be a place for that type of ceramic work.
So I'm gonna swing back on the personal story. I know we jumped, but it was a good segue. Who was the one that influenced you the most as a mentor in your dental career?
You know, mentorship for me, I don't think was the stereotypical mentorship path. I don't think I had one specific faculty member that I connected with, that I would be my go-to person to get any advice for. But mentorship for me, I think, has been in every part, and it was in small pieces. So what I took was a little bit of influence from people who I was really encouraged by, both in school, I would say, in residency. For the most part, my co-residents, my older co-residents, had a major impact, because that's who I spent most of my time with in the late nights, and they really kept me accountable for everything that I did. So they would go through the treatment that I was doing, look at the lab work I was doing, and they would grill me, why would I do that? Why would I do that? Why would I do that? And that's fundamentally what prost is a justification for every decision that you're doing.
Correct.
Because you don't want to just use patients as a trial and error. You have to be for sure know that what you're doing is the right thing and have the justification to do it. So they were the main people who instilled that in me, and I carried that along through my whole career, essentially. And then as I entered my work life, it would be nearly every single person that I worked with. I always took something from any bit, if it were work ethic. Some people taught me to be comfortable with the uncomfortable. Some people told me to be unapologetically yourself if you think it's the right thing to do. And then it's just simple practice management of how to deal with people. It's so there's so many things.
And that is a big part. I'm glad that you brought this up, because here when you were doing your training, you were spending a lot of time in the lab.
Yeah.
So there's no human contact.
Yeah.
But yet in real life, you do still, because I know prosthodontists cannot take that away from them, the lab a little bit, but not as much, but more with the patients.
Yeah.
You spend hours with the patients. And that's a whole school of thought that that you need to learn how to deal with it. Dentistry today is fun. Dentistry today is way totally different than when I did 30 years ago, but you, at least 10 years ago. What do you think it will define, or how it will be for the new dentist, the future dentist? Do you see a big change, or that's it? We had a big...
there's so many things that are going to change, not really change, but influence dentistry for the next generation, fortunately and unfortunately, I think social media has become a big part of our life. Fortunately, in the way that some of the branding has brought a lot of education to the layperson, so that's good. Unfortunately, it is a lot of information and contrasting information. So now the new generation of dentists have to decide what is their
What's
own
true,
philosophy.
what is wrong,
Exactly.
what's fake. Sorry.
Yeah.
But also for the patients.
Yeah,
And you brought up a
exactly.
very important thing. You know, I've heard so many times, oh, I saw them on Instagram. I came because I saw them on Instagram.
Mm-hmm.
Or, I mean, I don't know. Back in the day, we used to have a reputation by word of mouth,
Yeah.
confirmed by
Yep.
somebody who had a treatment, not but what they see on a picture.
Yep.
And that's what scares me, that talented people like you, stars like you, might not be discovered because you don't spend time much on Instagram and so on and so
Right.
forth, but yet you are the star that people are not seeing
Right.
because you're not somebody who goes brag and
Right.
does the stupid things and whatever it is.
Yeah.
Yeah. So it's interesting. So you think this is the biggest challenge the young dentist is going to find versus the older generations?
It's one of them. I don't think it's the biggest. It depends on what the person takes out of it.
Yeah.
Like if they stay on track, then they won't have any issues with it. A big part is, it's all kind of convoluted because dental school right now is way more expensive than it
Sure.
ever was. So
And it's going to get more expensive.
So then you're creating dentists who are now, well, at least for myself, averse risk of life in general. So then we're looking for stability. And then with stability comes what you're going to do financially. Is it usually in the traditional sense, most dentists would graduate, maybe be an associate for a little bit, then own a practice, and that's their life. Now we're in a world where some people don't want to take that risk, or they just financially cannot afford to buy a practice, and we're looking for financial stability. And then where you get that is now through corporations and who are offering jobs, which are stable, but then you run the risk of having that autonomy of K. Because then when you own your own practice, you can run and do whatever type of practice you want.
Correct.
And you can develop your own philosophies, your own style of practice. But when you're in a setting of someone else, you kind of have to go by the guidelines and
That they put,
protocols
yes.
that they instill.
Yeah.
So in that way, the next generation kind of has to balance stability versus their own autonomy of care. And sometimes you're fortunate enough to find the balance, and sometimes you feel like you're stuck in a certain situation. So then it kind of creates dentists who are less encouraged to be stuck in one spot and be more flexible and to be able to move with wherever it happens. So
how do you find yourself in New York Smile Team? How does it, is it something that gives you this freedom and you
absolutely.
Yeah.
I mean, if it's one thing with me, I do what I want to do.
Well, I know that. Don't I know that?
So once I feel uncomfortable with what I'm doing, it's not for me.
Yeah.
And that's the great part about our practice, is that we're fundamentally private practices run the same way how we want it to be. I get to do exactly the type of dentistry that I want to do. Just I don't have to deal with the headaches of
Correct.
running a business.
It gives you the nurture of growing in it, yet you don't have to deal with the noise of
Exactly.
the administrative and the risk, the financial and all of that. So that's it's nice to hear. I hope a lot of people will copy what we are doing
Yeah.
in the future, that we can save dentistry from corporations. Yeah. So now that we talked about, although you didn't want to talk about that, That's funny. See, I told you the conversation will go. The clinical philosophy, that's important, that people know your philosophy and how you take care of the patients. And so what's your philosophy in treatment?
I mean, simply put, I simply just want long-term health for my patients. So that means building lifelong relationships. I am at a great age where I hope to be the dentist of people's lives. Like,
Correct.
it is a fantastic position to be. And how will I make that happen is through comprehensive treatment that is integrating aesthetics, restoring function, maintaining biology, and essentially just doing treatment that presents the most predictable outcomes.
Yeah. So you care about the long term of your cases.
Yeah, absolutely.
Which ties up later on that what you said before with Instagram and all of this, that they just put the crown, they take a picture of it and they show it. Yeah. So that's beautiful. So in the same venue of the philosophy, everybody calls excellence. They use these big words, excellence and empathy and whatever. But so let's talk about excellence. So how does excellence in dentistry mean to you beyond the technical skill? Because I know you, I know a lot of people you treated them. They know how skilled you are. So the question is, what is, in your opinion, excellence in dentistry?
Well, excellence comes to me in two different sides. You have the patient-driven aspect, and then you have the clinical aspect. Patient-driven is you simply just have to listen to your patient's needs, know what your patient's own philosophies are of their own health, and just knowing who they are. So that has its own category. And then clinical excellence would be everything that I learned. So having the correct diagnosis to come up with the adequate treatment plan that presents the most predictable outcomes of treatment. So
correct. Yeah, it goes back to the diagnosis. As simple as that.
Yeah.
That's how you can predict your prognosis and all of that. It's funny enough, I know I'm going on a tangent here, but that's fine. Just bear with me. So on Monday, I was giving a lecture, and I told the audience, I had oral surgeon, general dentist, prosthodontist, and perio. I told them, how many of you have heard about the perio diagnosis? You know how much I'm like obsessed about it. So none of them. It shocked me. I told them, what is periodontal health? They didn't know. Yeah. So, boom. And how can you build up a whole treatment if you don't know the most basic thing, which is a health periodontal? What's the oral health? Yeah.
Absolutely.
So, boom. I love that you mentioned it. You got me on that. So, we talked about the clinical skills, the philosophy, the excellence. What's excellence? Talked about the long term, and now, how can because the patient that they don't know you, for instance, they come to you, and since you're not one of these people who do the Instagram and whatever, so they need to trust you. And you mentioned, I look young, I'm still young. I mean.
Funny enough, this week
So
I went to pick up medicine from the pharmacy, and I got carded because I look like a baby, essentially.
Me too. I always tell the patient, it's funny. I'm not joking. Yeah. I tell them, don't be fooled. I'm old. I've been doing this for 30 years. They look at me like I'm not. Yeah, well, we finished early probably, and we're blessed or not blessed to look young, but you have the experience. And people look at you and they want to trust you. How do you think people can trust you, or how can you gain their trust?
It's funny because I meet a lot of patients doing their regular hygiene. And For hygiene appointments, you spend the majority of the time doing your cleanings, and then I come in to do an exam and whatnot. But I always make sure that when I go in, it's putting the person in front of everything. So I want to know, I mean, I'm from the Caribbean. Like, we are people. Like, we want to know about your mom, grandmother, aunt, uncle, everything. Like, it's just in our nature. And because it's genuinely interesting to me, I don't have to write it down to remember next time. Like, it's just natural for me to remember, because I want to know my patient. Like, so that in itself, I think, breaks the ice, essentially. It's just when they feel that connection
That
with
you're
you.
real.
Yeah. Like, that you're a genuine person and you're not here to come and find something on their tooth. Like, it's just meeting someone.
So that brings us to the same thing, that learning how to communicate with people, learning how to have that personal skills, which is lacking more and more with the younger and younger. Lack of interpersonal contact and all of these things. I think it's what you said is huge, that you take the time to learn them and know about them, and they become your family.
And that's something you can't really teach someone. You just, it's your personality, really.
Correct, but they need to learn it though, because in reality, like, think about it. In 28 years I've been in private practice. I'm Peru. I don't see teenagers. I don't see. They are all in their 40s and 50s. So you see them now in their 70s, and you spend 28 years with them. You know everything about them. They know about you. They become your family. And if you lose one of them, it hits you. So it's so the bonding is very important if you want to build your practice. Okay. Well, we did quite a bit of things so far. We talked about the mentorship, so we're not going to go back. But still, what would you think? Because some people need mentorships. So, young dentists, what should they look for in mentorship?
Well,
in your opinion,
they need to take a step back before looking for a mentor. They actually need to look within themselves to have a vision for their own persona, because without that, what type of mentor are you looking for? You're kind of looking lost in space. So you need to have an inner question within yourself to decide what you're looking for. From that, then you can look for someone who is you're aligned with ethically, you're aligned with career-wise, you are aligned with philosophically for your type of dentistry that you want to treat. So it's multi-layered, essentially.
It is. Wow, Laura, you're impressive tonight. It's funny. I get to know more about. No, because it's true. What you're saying is, this is what people. They talk about mentor like a god. No,
exactly.
You need to have somebody that you are aligned with them in so many ways. And even when you work with someone, you have to be aligned with them. Otherwise, you're like bumping into each other all the time.
Absolutely.
So.
And it's easy. Like, when you click with someone, you click with someone. Sometimes it's just a force that you can't even describe. And hopefully some people that's easy to find, and some people it's not that easy to find.
Correct. So there's two things in dentistry that are important. Three things, in my opinion. Actually multiple, but let's focus on a few things. And because sometimes they connect with each other. So definitely the skills, the personality. If you don't know how to speak with people, they cannot discover you as it's like dating. You have to, they need to feel comfortable with you in order to give you an opportunity to work on them and then discover your skills.
Absolutely.
So we talked about those two. Then then if you, like in our organization, each one is running their own location, completely independent. You do the dentist you want, but you need to be a leader, right?
Yeah.
You need to be a leader, and you need to learn about business. I mean, unfortunately, it's something to be said, because you have to pay your bills, and you have to grow, and you have to make a living.
Yeah.
There's nothing to be ashamed of. You know, we learned in dentistry, we cannot talk about money. Yeah, well, unfortunately, it's a business, a small business.
Yeah.
So, but at the end of the day, you are a leader,
Right.
and you need to have a kind of a culture that is important for you, that you integrate within that bigger picture.
Yeah.
And people throw this word culture in organizations and stuff, but basically it's a relationship. It's nothing more than that.
Yep.
It's a family.
Absolutely.
So either you have this commonality with them, or you don't.
Yeah.
So when did you discover that this culture and leadership are important to you?
I don't know if there was like a defining moment, but I think organically, just by being a good person, just by doing the right things, representing myself the way that I want to be seen, organically makes my peers, my co-workers want to be like that as well, essentially.
Yeah, look up to you anyway. Yeah.
Yeah, because then if you fundamentally, your goal is to provide the best care for your patient, you do everything in your power to make that happen. So by doing that, everybody around you is witnessing that, so they also want to do that. So sometimes you don't even have to verbally say anything, just pure actions.
They got you.
It means a lot.
Yeah, because there's certain people that run the practices. They run it with, tough, not very nice, and people work for them because they need to work.
Yeah.
And basically, you are the opposite.
Yeah.
You're kind. You're sweet. You're genuine, and you're passionate and empathetic. So you have everything in it to be do you think you find this also within us, within the New York Times?
I mean, what's fortunate for me is that I'm not the boss. So then,
Yeah. But we don't deal with it as a boss.
So, but no matter, we get along. We're friends. Like everybody is friends, and we get along so well. And I get to know them on a personal level, and it's not just work all the time. It's everything that we do is trying to make everybody's lives easier.
Correct.
And to make things work easier.
That's what it is.
Exactly.
And if you make it easy, everybody is happy. They can do the job, and we can get a good outcome for the patient. Absolutely, yeah. So basically, you answered the following one: what kind of a leader you like to be, to aspire for your team? Or you said it, and that's what I told you. It flows quickly. Yeah. So in the technology, so now we did the leadership culture. We mixed everything together. But now let's go back to the technology, aesthetic, and the future. So technology is moving fast. Digital and dentistry, I remember, it exploded after COVID. A long time it was struggling, and boom, it exploded. And now it's kind of a plateaued. Now all of a sudden we are hearing AI. So what excites you in all of these things? Is there anything like a specific, what excites you about how the dentistry is heading? Do you think AI is going to be a transformative thing in dentistry? Like people are afraid of it and stuff. Boom.
It's an interesting question, because AI, technology comes in two components in my mind. There is the AI section, and then there is the digital 3D department as well. And they all are going to have an excellent place. AI, I've heard concerns with the next generation not being able to diagnose and being reliant on AI. But to me, I just see AI as a great subsequent tool to use. So it's backup, essentially.
Correct.
So as dentists, there's so much to look at. And AI is there to enhance your performance, essentially.
Correct. Very well said. Very well said. Very well put. I remember when they started talking about guides, 3D printed guides. Oh, anybody can do implant placement. Oh, no, it did not.
Yeah.
It did not. What we learned that if it's a tool, that if you don't know how to treatment plan the placement of the implant correct, you print it, it's still going to be off.
It's the same with ceramists. You can't be an expert digital ceramist without knowing the analog version, because without knowing the analog, you don't know the anatomy of the teeth.
The mill cannot make the tooth looks beautiful unless your artistic thing at the end touches
you still
it.
need to know.
So it's an enhancement. It's just it's a tool to help.
Yep.
Dentists are always going to be needed. So we talked about that. So basically, when we talk about AI and stuff, people think that the profession itself, whatever profession it is, it's going to lose its soul because it becomes mechanized. And do you think this is possible in dentistry?
To lose its soul?
Yeah.
I don't think AI is the reason why people feel like dentistry is losing its soul. I feel like in general, medicine and dentistry just feels like it's losing its soul just because of how the world is going right now. People feel like because a lot of things are corporate, when you answer the phone and you click and you have to click 1 to do this, 2 to do this, 3 to do this, it's kind of like a little frustrating when you really just want to talk to your doctor. And that's hugely in the medical field. Dentistry is a little easier because we're not at that level yet. So you still feel a connection to your dentist. Yeah. And I think that's the soul of the dentistry is that people want to know that their dentist is there for them.
Correct.
Which we're able to maintain because what's great in our practice is that I'm seeing my patients and they're not calling and they're being put with someone else.
Yeah.
Your
patients are your patients.
Exactly.
Yeah.
They have consistency with one doctor who is their doctor, and they know that that's what they're getting.
Correct. And that is what we're trying to achieve, is to keep this personalized dentistry and treatment, healthcare, because we forget that we're part of the healthcare. Yeah. That's beautiful. Losing its soul, you're right. Yeah.
And knowing that they can get through to me whenever they need me is probably one of their biggest worries when people hear corporate dentistry, essentially.
Absolutely. And like we listen about concierge dentistry, It's funny. Like yesterday I had a patient for a long time. Oh, my son is using a concierge dentistry. Deep inside, I said, well, we are all concierge dentistry.
I actually thought about that because there's concierge doctors and you have to pay a membership to be part of this concierge. And I was like, I'm giving up this concierge dentistry for free.
Indeed. Yeah, we don't charge membership.
Exactly.
We are available for them the whole time. So in practices like ours, we are trying to create this personal touch for free. They can come to us anytime.
Exactly.
They can contact us. And even if the beauty also of having a team is like something you're not there, somebody will immediately take care of them until you come back and so on and so forth. So that continuity of care is extremely important versus if you were practicing on your own.
Exactly.
Which I did it for a long time, and that was one of the biggest headaches. You go on vacation and then what's going to happen if somebody... So we're going to go back now to a little bit of identity, representation, legacy without being philosophical. how important is authenticity and personal identity in how dentists show up today?
Oh, that's pretty much what you have to run off of. Like you need to be a genuine person for people to connect with you, because we're living in an era where you're facing social media and you have all of these
Fake stuff.
Yeah. So once they meet you in person, they have to feel like a connection with you, or else what's the point, really
Correct.
and truly?
Correct. That's why they call it concierge and more. So what would you like people to know about us as New York Smile team?
I mean, we touched a little bit on it. I mean, we're a team of excellent dentists. Like, that's hands down.
That's nice.
We always have an interdisciplinary team, so everything is communicated well, diagnosed well, communicated well, and executed well. There is no worry of having to worry about who you're seeing, because you know who your dentist is. Like, that's number one. You have all access to them all the time. So that's the best part. And then when we're not around, we have backup of a team that we already know. So
and they can get you immediately. They know what you
Exactly.
want and what you do, what's your style of treatment. So we're getting to the end.
okay.
See how time flies? And let's talk about the closing reflection.
Okay.
What keeps you excited to come to work every day?
Gosh, this can go so many different
Yeah, I
directions.
told you I'm going to give you one of them. It's hard.
It is great to be able to know you're going to a place of work that you enjoy being there. Like, there is never a morning that I dread going to work. And it sometimes doesn't even feel like I'm going to work. It's just part of my day. I'm going to be with a team that I greatly enjoy. There's so much laughter that happens in the office. And then I get to either meet new people, new patients, or continue care with my patients that I've already met. And that's a joy. It's meeting someone new every day. And then when the day finishes up without any hiccups, then you go home and you get to be with your family again. And it's fulfilling to know that you're being able to support your family by doing something that you love, that
And
you're
good.
passionate about, and having a workplace that you enjoy. Like,
That's beautiful. I was going to ask you another question, but it's such a beautiful answer that I think it will be the best to close at that. Yeah, no, you're right. It's the fact that you feel like you did something positive
yeah, absolutely.
every day. It makes the best thing about it, and that's what we love about dentistry. And that's why we're fighting not to lose that beautiful thing about it. Well, Laura, thank you so much for
Thank you.
multiple things. I want to thank you. Thank you for trusting me in that journey. It's very important to me. I think you are an amazing, talented person. And
Thank you.
anybody who has heard you today will know what I saw in you. We have a common friend that connected me with you that is very
Yes.
dear to my heart.
Yes.
And I will always thank her for that. And I'm very proud of you, and I think you're going to be an amazing star.
Thank you.
And I can feel like my legacy is in good hands.
Thank you.
Thank you, Laura.